Congress approves anti-addiction bill as funding fight continues. Washington. The Senate gave final approval Wednesday to a sweeping bill aimed at helping states respond to the deadly opioid epidemic, even as lawmakers continued to fight over providing money to expand addiction treatment and prevention programs. Supporters of the bill, which passed the Senate 92-2 and is expected to be signed by President Obama, said it would dramatically change the trajectory of the addiction crisis that has ravaged the nation, claiming thousands of lives and overwhelming the criminal justice system. This is a historic moment, the first time in decades that Congress has passed comprehensive addiction legislation, and the first time Congress has ever supported long-term addiction recovery, said Sr. Rob Portman, R. Ohio, a chief author of the legislation. This is also the first time that we've treated addiction like the disease that it is, which will help put an end to the stigma that has surrounded addiction for too long. Democrats called the bill a good first step, but said Congress must follow up with a big boost in federal funding to make a real dent in the opioid epidemic. If we don't do the money, it's a lot happy talk without the oomph that we ought to have, Sr. Sherrod Brown, D. Ohio, said last week. In an email, Drive. Mina Mike Kalfas, an addiction doctor who practices in northern Kentucky, said the bill is a great start. But he said so much more needs to be done to turn the tide. Without integrated care and treatment, adequate resources, societal change and harm reduction strategies, etc. Without successful implementation of these things we will continue losing, he said. The bill, called the Comprehensive Addiction and Recovery Act, would authorize $181 million in new federal money for a gamut of opioid and heroin abuse efforts. It would also promote alternatives to incarceration for those with substance abuse problems and expand access to naloxone, which reverses the effects of an opioid overdose. Among the most significant provisions is a measure to allow more health care providers to administer medication-assisted treatment for opioid addiction. Under current federal law, doctors can only treat 100 patients at a time with buprenorphine, one of the most effective opioid addiction medicines. The CARA bill leaves that limit in place, but it would allow certain nurse practitioners and physician assistants to provide buprenorphine treatment to addicts seeing recovery. XX quote from Dr. Here. Brown and other Democrats agreed the bill will usher in important policy changes. But without the money to back those up, they argued, it would be more symbolic than substantive. This bill is like a Hollywood movie set, something that appears real on the surface but has no substance and no life behind its facade, said Sr. Charles Schumer, DNY. In the White House's budget for fiscal year 2017, Obama asked Congress for $1.1 billion to combat drug addiction. Last week, Congressional Democrats tried to add $920 million in new funding to the CARA bill. But Republicans blocked that, saying they would look at plumping up spending on drug treatment and prevention programs separately, when Congress takes up the annual federal spending bills. That's how the system works here, Portman told Ohio reporters Tuesday. He noted Congress increased funding for opioid-related addiction programs last year and is on track to do so again for fiscal year 2017. There is money in the pipeline now, he said. Earlier this year, the Senate Appropriations Committee approved a health spending bill that would provide $261 million for various opioid treatment and prevention programs. That's a 93% increase over the $135.2 million Congress approved for fiscal year 2016. But Brown and others noted Congress is unlikely to complete work on the individual spending bills before the end of the fiscal year. Republican leaders are already talking about passing a stopgap spending bill to keep the government open after October 1, when current funding for virtually all federal programs will run out.